How to measure for JOBST Elvarex thigh-high AG lower extremities. To measure for JOBST Elvarex, you will need a pen to fill out the order form, a skin pencil to mark the body, an order form, a measuring tape, a measuring board. You can also enter your order directly into the measurement sheet within the JOBST eShop. The JOBST Expert Voice function allows you to use voice controls to enter your measurements, keeping both hands free. There are two types of measurements you will need to take. Length, the cumulative distance between 2 points. Circumference, the measurement around the limb at set points. In order to measure for an optimal fit of our flat knit garments, circumferential measurements should be carried out under different levels of tension. As shown here, the tension you can use ranges from 0, lay-on measurement, to 3++, maximum tension. Measuring for JOBST Elvarex involves tensions 0 to 2+ pull. The maximum tension of 3+ is shown here to give you an indication and is actually not used while measuring patients. For each of the measurements required for JOBST Elvarex, a specific tension level will be used. This video will indicate the amount of tension to be used, displayed on the screen using the matrix icons. You will always find it shown next to the C measuring point. Please note that the pain tolerance of the patient must be taken into account. Measuring. Let's get started. Please keep in mind, medial measurements are taken on the inside of the limb, lateral measurements on the outside. Proximal refers to points closer to the head, distal closer to the feet. First, measure the foot lengths and circumference A with the patient standing. Mark all length measuring points on the foot. The toe can be open or closed. For open toe slant foot, measure at both sides of the foot. Please note that a slant foot offers the best anatomical fit. First, measure the length from the back of the heel, aligned with the board, to just under the base of the big toe. Second, measure the length from the back of the heel, aligned with the board, to just under the base of the small toe. For open toe straight foot, measure the length from the back of the heel, aligned with the board, to just above the base of the big toe on the medial side. Measure length A lateral as well, and take the middle of the medial and lateral measurements. For closed toe, also measure the length from the back of the heel, aligned with the board, to the end of the longest digit on the medial side. Please keep in mind that you can also measure for a slant foot with closed toe. Measure the A circumference. This is measured at the base of the toes or the widest part of the foot. The tension for this measurement is 1+ pull. Next, write the foot measurements on the order form. Before you start the next stage, move the patient into a supine position. Take all measurements until you have reached measuring point G in the supine position. Position the patient's leg carefully on the measuring board, with the foot flat on the board and the heel as close to the board as possible. If a board is not available, make sure that the foot is flexed at 90 degrees during measuring. Please note that length measurements do not follow the contour of the leg. The measuring tape must be kept in a straight line from the heel to the pubic bone. Now proceed with defining the length points B to F on the leg. Mark all the points on the leg. Point B is located just above the malleoli, at the narrowest part of the ankle. If the limb definition is unclear, we recommend taking the measurement approximately 10 centimeters from the heel. Point B1 is located at the insertion of the Achilles tendon into the calf muscle. If you cannot feel the Achilles tendon, B1 is at the midway point of length D. Point C is located at the biggest calf circumference. When calf circumference is prominent, C is located in between B1 and D. Point D is located 2 fingers below the patella at the pre-patella bursar. If the patella is hard to feel, measure 2 fingers below the knee crease. The E measuring point is located over the middle of the patella. To measure length E, the leg must be extended and flat against the measuring board, with the foot in the correct flexed position, 90 degrees toward the board, and the heel as close to the board as possible. Point F is located mid-thigh. Next, write the length measurements on the order form. Proceed with measuring the circumference at the marked points. You should always consider the correct level of tension required, as explained in the beginning of the video. Measure the Y circumference. This is taken around the heel from the back of the front crease, with the foot positioned at maximum dorsal flexion. The tension for this measurement is 0. If there are deep skin folds or irregular contours, measure circumference Y more towards proximal. Measure the circumference at point B. The tension for this measurement is 1 plus pull. Measure the circumference at point B1. The tension for this measurement is 2 plus pull. Measure the circumference at point C. The tension for this measurement is 2 plus pull. Measure the circumference at point D. The tension for this measurement is 1 plus pull. Measure the circumference at point E. Flex the leg to 30 to 45 degrees. This allows comfort and range of movement while wearing the garment. The tension for this measurement is 1 plus pull. For legs with significantly more tissue above the knee, measure above the knee with 1 plus pull. The circumference of point F is the anchor point which holds the garment in place. The tension for this measurement is 2 plus pull. Please move the patient to a standing position. Measure the circumference at point G with the patient standing. Measure at the widest part of the thigh. The tension for this measurement is 2 plus pull. Length G is measured up to the gluteal fold. This may not be the same point as the measurement for circumference G. If you order top comfort zone, you also need length K. Length K is measured up to the crotch. Write the length and circumference measurements on the order form and proceed with the order.